We've got a group. All right. Well, thanks so much for being here today, folks. This is the first of a handful of budget recommendations that will be released in the coming weeks, and it's no coincidence that we're starting with mental health. And it's no coincidence that we're in Madison today to talk about that. Madison is one of 64 school districts that's receiving funding through the School Mental Health Services Grant. With the help of their partner, the Catholic Charities, this funding will increase efforts to help kids overcome mental health challenges. Now, that's the good news, and that's great things that we should celebrate. But the fact of the matter is, when we put our budget together last year, we did not anticipate the magnitude of the demand. So I'm joined today by Dane County Executive Joe Parisi, who will tell you about the work being done here that made it easy for our grant readers to accept that application. But you're also going to hear him talk about the fact that our state support for this work and the work of other districts is sorely lacking. That's why in my budget request that will be upcoming, I will be seeking a 10-fold increase in state dollars targeted towards mental health supports. Part of my request will ensure all applicants of the school-based mental health grants receive funding because this work is simply too important only to fund some. There should be absolutely no losers in this race. During this round of grants, a high demand that meant that school districts that had very, very well-deserving proposals, schools that are doing the right kind of work, schools that are primed to do some good things for kids, did not receive funds. And frankly, that includes Mount Horeb, which was featured recently by the State Journal in their efforts to bring the community together to address youth suicide. This support is too important to pick winners and losers. And it's too pervasive to stop moving forward. In Wisconsin and across the country, we know that 1 in 5 kids face mental health challenges. With the help of talented professionals, the kids that will be working with them can overcome these issues. But right now, these professionals are in short supply in our schools. That's because it becomes a problem then, because when you consider that 75% of all school mental health services that are being provided right now happen in the schools. So my next budget will seek to expand the state commitment to hire more school pupil services staff. And we'll be requesting additional dollars to help train and assist staff in recognizing and serving our most at-risk kids. So with me today also is Anna Moffett, representing the Wisconsin Family Ties. And Wisconsin Family Ties brought us a recommendation, a super recommendation, to fund parent peer navigators. These are folks that can help families connect, especially in times when it's very stressful and crisis. They will direct them and help them find the help that their kids need. So the stories you'll hear from County Executive Parisi and Anna are really powerful stories. And I'm optimistic that the issues that we're going to be discussing today will become law. There's a great deal of positive energy, not only across the state, but clearly in this room with the folks that are standing behind me. They care about this issue. This issue is critical to the success and democracy, frankly, of our state. We can't let any kid be without help in this area. So first of all, I'm going to turn it over to County Executive Parisi for some perspective on the work being done that can be transformed with additional state support. And I thank Joe for his interest in this critical matter. Joe?
Good afternoon. I'd like to thank Superintendent Evers for his focus on this issue and for his budget proposal to increase the funding in this area that we are in such great need of in so many levels, and particularly in our schools. We know that mental health challenges occur at various degrees, from depression to anxiety and to the extreme tragedies that we've seen in Mount Horeb and elsewhere in recent days. The history of the mental health teams in Dane County begins about 7 years ago when I was visiting some local officials in Verona in a church basement, meeting with some of our social workers and school teachers and school staff and law enforcement. And I just gave an open-ended question. I said, what is the issue that's most challenging for you and your community right now? And to a person, they said mental health services for children, particularly within the schools. Because due to state cutbacks, there are fewer staff, there is more trauma in many of our communities, and a growing challenge and occurrence of mental health issues, all the way from people being distracted to people having a mental health crisis in the class. So from there, we decided to pilot in Madison, Verona, and Sun Prairie the concept of the mental health teams, which is a partnership between the county, the schools, and Catholic charities, in which we have 2 mental health professionals in middle school catchment areas. And they are there to be there not only for the crisis time, when there's a mental health crisis, to come in and help de-escalate without having to involve law enforcement, but also to work with staff and to work with kids, to help staff spot maybe the signs of depression or anxiety, or you see a child acting out, maybe it's because they have a mental health challenge. And then from there, the professionals step in and they connect those kids and their families to people who can give them the help that they need. And the response that we got from that pilot program was so overwhelmingly positive from staff and parents that in Dane County, we have gone county-wide now. We have 12 mental health teams in schools across the county. Dane County invests $1 million annually into these teams. And I just want to share with you the results of a recent survey we did with parents and staff. And for the sake of brevity, I'm just going to give you some information about the staff feedback that we've had from these teams. And we, I believe, have copies of this we could give to people. 69% of school staff saw a decrease in office discipline referrals and or suspensions. 69% saw improved attitudes toward learning. 80% saw an increase in their understanding of how a student's mental health impacts their academic success. And it goes on, that school staff, parents see the value in these services because they also take a multi-generational approach. They reach out to the young person, but they reach out to their families also and get them involved and get them connected to the services that they need. So why doesn't every school in the county and in the state have this? It's a simple fact of resources. And Superintendent Evers is spot on when he says that we need more funding to go so that more teams like we have in Dane County and like some folks have elsewhere can be put on the ground, boots on the ground, helping our children, helping connect them to the services. I guarantee you, you will see results. You will see kids getting the help they need and getting that help earlier. So I'm thrilled to be here today to speak in support of this budget request, and I hope that it is successful moving through. So thank you very much.
Thank you. Thanks so much, Joe, for that great description of what's happening in Dane County, and thanks for your help. And I know the state funding will go a long way to bring people together around this particular issue to get the services directly to kids. And talk about services directly to families. I'd like to next introduce Anna Moffett from Wisconsin Family Ties. Anna and the Family Ties are working with schools and community all across the state of Wisconsin to fill the growing need around this issue of emotional and mental health services and support. So it's an honor for me to introduce Anna, and take it away, Anna. Thank you.
I want to begin by saying I wish I had chosen a bigger font, but bear with me. So, thank you for the opportunity to speak to you today about the positive impact that parent peer support has on student mental health. My name is Anna Moffett, and I work as a parent peer specialist at Wisconsin Family Ties, a family-run nonprofit organization committed to improving children's mental health through parent peer support. Our staff, located throughout the state, are all parents of children or youth with social, emotional, behavioral, or mental health challenges. Every day, we have the privilege of working with other parents whose children share similar needs to our own. That shared experience helps us to engage families and connect them to schools and other agencies in a way that is unduplicated by any other service. I've been on this journey for nearly a decade. I vividly recall sitting in a doctor's office at the Weissman Center with my son and several clinicians, reflecting on my worries about his behavior that could no longer be ignored. After an exhausting slew of questions and observations, we were left with a diagnosis and faced with an overwhelming set of systems to navigate to get my son the help he needed. I was scared, paralyzed, and felt deeply alone. Parenting a child with mental health needs is often remarkably isolating. In addition to having to work their way through doctor's offices, therapy sessions, and special education services, parents must also face stigma and blame. As parent peer specialists, my colleagues and I bring a unique level of understanding based on our own life experience and a high level of knowledge as a result of our in-depth training. With Wisconsin Family Ties, families do not have to feel alone in their struggles. Bringing the benefits of parent peer support to assist families with school-related challenges addresses a crucial area of need. Our children spend so much of their time in school, and our public schools can be the one place that young people with mental health needs are welcome and served in our communities. But school is also a place where our children sometimes struggle, along with the teachers and staff who work with them. Additionally, the rules, regulations, and structure of special education can be daunting for many families to navigate. Parent peer support helps families partner with schools to effectively share their expertise about their child with the professionals who work with them. And the results are highly encouraging. In research with parents who received Wisconsin Family Ties parent peer support services, parents overwhelmingly say they feel better able to cope with their family situation, and that our parent peer specialists demonstrated how to resolve conflicts and modeled ways to respectfully work with schools. A sobering 28%, 1/3, said that without parent peer support, they didn't think their child would be living at home with them. Wisconsin Family Ties has worked closely with DPI over the past few years to pilot parent peer support programs in several districts using federal grant funding. Today's announcement takes the groundbreaking next step of proposing a state-level investment in student mental health through parent peer support. Supporting parents to support their children is a critical piece of school mental health. And I am simply thrilled, both as a parent and as a parent peer specialist, to be here and speak in support of this state budget proposal. Thank you.
Thanks, Anna, for the great description of parental support and guidance and your own personal journey on this issue. You know, when we talk about public education, that's my job, and we always tend to look at the academic success of kids. And is that important? Absolutely. But the bottom line is, if students aren't well, they're not going to learn. And we do have an obligation under this area. I know we seem to be crossing boundaries here among institutions, but the fact of the matter is that's the only way we can solve this problem, is to make sure that we have our nonprofits involved, that we have our school districts involved, have our counties involved in this effort. It's absolutely critical. So I am so proud to be surrounded by these folks today. And the last person I want to introduce is Armando Hernandez, who is the Assistant Director of Integrated Health Student Services right here at the Madison Metropolitan School District. Armando?
Thank you. In the Madison School, we are really excited about this ongoing investment in school mental health. As was mentioned, 1 in 5 of our youth struggle with mental health concerns. And we know that a large majority of those also for their struggling accessing mental health concerns. Now, while we know that our youth and families are indeed resilient, We know that they at times need additional support, and it is important for us to meet that need by making services the most accessible for the families as they can. Part of a couple of the initiatives that in the Madison schools that we have been doing, one of them is a program called Behavioral Health in School that is a partnership. It integrates mental health clinicians into a school, such as here in Schenck Elementary School. And basically that clinician, and right now one of our current partners is Catholic Charities. For the next year, as we expand this program, we're also are bringing in Children's Hospital of Wisconsin. We have a clinician that is here offering mental health services where the services are needed. That clinician also partners with our student services staff. That is with our nurses, our counselors, our school psychologists, our social workers, to basically meet the needs of our population. And we're also are looking into other programs, such as a program called Bounce Back, which is a trauma-specific group that is offered to those youth that are struggling with issues as a result of trauma that they have experienced. We know that in our community, the issues around mental health need innovation and creativity. Also need our ability to be able to work together to meet that need. So we're very excited with this additional investment to put it into these type of programs so that these services can not only help our students, also transform the climate of our schools, but also make these type of initiatives sustainable moving forward. Thank you.
Well, as you can see, people are excited and really serious about this issue. It's not a happy day when we have to ask for 10 times what we had before, but it's not a happy day for any child in the state of Wisconsin who is suffering from mental health issues and being challenged on a daily basis. And I'll just leave you one story that resonates for me for a long, long time. And I won't name the school district. It's a affluent school district. This crosses all boundaries of kids, frankly. And this is an affluent school district, mainly white. And they did the youth risk behavior survey every year. And a few years ago, they received the information back that it was in the mid-20s, about 25, 26% of those children in that school district felt helpless every single day. And you think about that. That's of families that are not necessarily struggling financially, or a school district that was providing the best they can. This is a huge issue for the state of Wisconsin, so I am very happy to be here with these folks to say it's time to turn this around. If we want our kids to succeed, we have to invest now. Be glad to answer any questions you might have.
What are you planning on submitting DPI's budget recommendations to them for? And are you going to do it in two different request forms like you did last?
We're gonna be doing it in fall, early fall, September, October, someplace in there. Yes, just once. Yeah, this one.
What's the tenfold increase mean in dollar amounts?
I believe it would be in the neighborhood of about $50 million. Pardon me, I'm sorry, 100 million. Oh yeah, over biennium, yes, 100 million, yes.
Mental health has been talked about in regards to this whole discussion on school safety grants that the legislature had earlier this session. On the topic of school safety grants, the schools and districts around the state applied for about $56 million.
Right.
On the total $100 million, leaving about $44 million. How would you want to see the remainder of that money used? Another round of school safety grants, or how?
I think it should be used in this arena right here. Clearly, guns are an issue. There's no question about it, but above and beyond school safety, it's issues about young people needing to be in a place where they can learn, place mentally and physically where they can learn. So yes, I think that leftover money could be used for training, could be used for any of the items that we're talking about here today. This is a critical issue. The fact that some of it was left behind, I think it was reflective of the kind of the narrowness of the scope of the original plan. Going once, twice. Thanks so much for being here. Thank you.